Welcome, Namaste and welcome to Dr. Shah's clinic. In yet another video on erectile dysfunction, we are going to discuss on how to talk about erectile dysfunction to your partner. So this is a very important question, and I get a couple of female patients who come into my clinic and who ask, who have difficulties, in kind of convincing their male partner to come to an ED clinic or a sexual clinic for a proper assessment and treatment. And I understand that, a male's ego is severely hurt when a diagnosis of erectile dysfunction is made. Men feel less men when they're diagnosed with ED. And more than anything, because the erection of an individual, is a overall marker of a man's general health status. It's also socio-culturally very important because over many decades, over many years, a sign of a man is a man, and an erection is probably the best sign that, his manlyhood or maleness is intact. So whatever. There's a lot of socio-cultural stigma around the top. And a lot of my female patients actually ask me this question. How can I discuss, doctor, how can I discuss about erectile dysfunction with my husband or my stable partner or my boyfriend or my intimate partner? Okay, I'll give you 4 quick tips that you should follow and you should, bear in mind when you're discussing about erectile dysfunction with your partner. Should you suspect your partner to have ED? Point number 1, remember to be kind and non-judgmental in your communication. So most important thing is to be non-judgmental. You never tell a man directly on his face that his erection is not. You never want to use such statements. If you're going to tell him that you're not getting hard enough, I'm completely dissatisfied with you, especially during sexual intercourse, that's going to result in a psychological problem for him. He's going to have, most probably he will end up with psychogenic erectile dysfunction for a very long period because every time he kind of approaches you, he's going to come with the worry, will I be able to get an erectile function good enough so that she's satisfied? Will I be even able to do sexual intercourse? So it's going to create a lot of problems for you. That's the last thing you want to say. Don't ever be direct. Remember to have your conversations outside sexual intercourse. If you have had sexual intercourse in the evening, keep your conversations for the next day morning or the next day afternoon when he's calm and when he's oriented. Never address a man directly on his erection. That's the first step. And remember to be very kind and be very, very gentle. Try to keep silent during the actual sexual intercourse session. That's point number 2. This is also a very, very important point with respect to erectile dysfunction is remember to be open, communicative. So what's very important is don't try to beat around the bush. So when you're speaking about a man's erection, you have to be to some extent discuss at a time that's not during sex. So if you have found a comfortable time, you're going to be, communicative. Try to be open, don't beat around the bush, don't tell, I felt maybe yesterday night was not so good and, blah, blah, blah. No. Come to the point, be firm, be kind, be gentle, but be open as well as communicative. So it's important to, to have an open communication because if you don't tell exactly what's the problem, the individual or the man he's not going to take any action on it. He's just going to be he's not going to correct himself or even work towards correcting the problem. You're going to live with the problem, for a prolonged period of time. So, we have seen patients. I'm telling you out of clinical experience, we have seen patients, and in such patients where, the communication is, when women, kind of become very verbal, sometimes even borderline abusive, what basically happens, the relationship actually fragments. And of course, women usually don't become verbal, they're not abusive at the outset, I understand that as well. Only women, for a very prolonged, if the erectile dysfunction has been there for a better part of 6 months to a year, that's when women, usually feel. Third most important point is, you can ask your man or your boyfriend or your intimate partner if he has, diabetes mellitus, or has he tested for diabetes? If he's eating properly, if his food habits are proper, if, you people are living separate or, you're living together and you have a habit of ordering from outside and eating food, ask him about his food habits or help him with his food habits. Cook for him food that is, low in carbohydrates and higher in proteins and higher in fats. Ask him to go for walking. Check his BP. You can buy a home BP apparatus and check because most of the time, with respect to erectile dysfunction, the commonest problems we pick up in these men are usually diabetes, hypertension, and cholesterol. So in almost 50 to 60% of patients, these are called organic processes leading to erection. Ask him to lose weight. So question him and you can ask him, you can also ask him to get a mastoid checkup. There's nothing wrong in it. Or ask him to, get a consultation. So that's something you should definitely question him about. And you can also advise him to stop smoking or stop alcohol if he takes too much of it and tell him that yes, smoking and alcohol affects erection and it's affecting our relationship at will. It'll be better if you can kind of quit these habits or at least reduce, the number of cigarettes or the number of amount of alcohol that you're taking. I'll be happy. And it's important to ask. Remember, you will not get anything unless you don't ask it. So ask it and, be firm about it. So that's very important. The 4th important point, when you're addressing erectile dysfunction in your partner is, rather than women, some individuals cannot really speak about sex and sexuality very openly. They feel inhibited. Maybe their personality trait is that they're introverted by nature and they find it very difficult. Please, if that's the case, if you're not able to speak to your partner in a kind, open, gentle, non-judgmental manner, please visit an andrologist or a sexologist. It will help you tremendously because we are the mediators. We play the mediator role. We will speak on your behalf. I'll speak on behalf of your husband. I'll speak on behalf of you to each other. What we do with respect to erectile dysfunctions, what we try to do is, keep each individual's expectations on the table. We systematically jot down points. And this is basically psychosexual history taking. So we, kind of lay down the points, from each individual's perspective, and we kind of cross-communicate in a very kind way. So it actually helps individuals overcome. You know exactly what your partner is expecting. He knows exactly what you're expecting. She knows what he's expecting. Sometimes the sexual dysfunction sorts out just because of conversation or a proper healthy dialogue. So that's something. And a bonus tip, that I would like to share with you is the individual or your husband, if he has any specific sexual fantasy. Some men, get attracted to women if they dress in a particular way, if they wear a specific perfume, keep their hair in a particular way. Men's sexual fantasies are so varied. So, sometimes you can even ask your partner, is there a specific way you want me to dress that so that you find me more attractive? Is there a specific thing you want me to do during sexual intercourse so that your erection lasts longer? We are able to enjoy sexual intercourse in a much better way. Things that you can definitely ask your partner if you're comfortable speaking on. If you're not comfortable, just forget to drop the whole idea. Visit a sexologist near you. Let him bloody do the talk. So I hope you found this video reasonably informative. I'll be making many more videos. Share this video with all your friends and loved ones. Please like, comment and subscribe. This is Dr. Shah. Welcome. I'll see you back soon with another video.